Hi, so my name is Anna Chimanyas and my report would be covering alcohol in pregnancy. So alcohol is a teratogen, so that affects the development of the embryo, and the CNS or the central nervous system is also very sensitive to that agent. Alcohol is harmful within the pregnancy during the development of the embryo because that is where the embryo starts developing its heartbeat, it forms its brain, and then again it affects the CNS. So that's where most of the problems actually start. So what happens is that when mothers consume alcohol, the blood passes through the umbilical cord, which is then how the baby absorbs nutrients and everything else needed for the body. So the effects of consuming alcohol within the pregnancy is also called the fetal alcohol spectrum disorder. So that FAST has a lot of classifications, if you would say, and in the report I'll be talking about that one as well. So one of the effects are miscarriage, stillbirth, or where the baby dies inside the stomach, or disabilities when the child is born. So the common features of the babies would be the smooth philtrum, or where the ridge between the nose and the mouth. They have most of them, well actually very common indication is that they have the smooth philtrum. They also have small heads compared to the normal children. And as discussed earlier, that FASD does affect the CNS. That means when the child is born, they would have poor memory, low IQ, poor judging skills, poor communication skills within other people. They would also have different speech defects. They would also have problems within the heart, the kidney, the bones. Also, research has shown that there are lifelong effects of FASD within how the people communicate. For example, many of those mental disabilities may affect how the person with FASD communicates with people, or like how they communicate within their surroundings, like at school. So FASD is like has a domino effect. So when people have poor memory, poor judging skills, poor lack of communication, that would result to mental health problems as well. Like that could give them depression, that could give them many problems that would root from FASD. That they would have difficulties finding a job. They would have difficulties finding or like connecting with people, and yeah, that could cause different addictions as well. It could come back to alcohol addiction, drug addiction, and many other addictions that would lead to the downfall of a person. Also, there's no safe amount of drinking alcohol when you're pregnant. So as early as possible, when a woman knows she's pregnant, they should already stop drinking alcohol. So it is advisable for women who are trying to conceive to stop drinking alcohol as early as possible. Also, even when women who didn't know they were pregnant and drank alcohol, it is best that they stop as early as possible. Also, for women who are alcohol dependent, when they want to drink, they should also seek help from professionals and not just leave it to tend for themselves, because that would risk their pregnancy and the life of the child that they're carrying inside their body. So yeah, that's just the overview of my report, and thank you for watching.